What caused my sciatica? That's a question I've been asked many times in 31 years treating patients with low back pain. Very commonly something simple like bending or twisting triggers an acute onset of low back pain. In a previous video we discussed the two different mechanisms, both intrinsic and extrinsic mechanisms, and this is a classic intrinsic mechanism where your back suddenly goes with a simple task which shouldn't normally cause problems. Hi, I'm David Fitzgerald, clinician for 30 years rehabilitating patients with back pain problems, and I'm going to explain to you in this video how disc problems occur. The commonest cause of sciatica is compression due to a bulging disc in the lumbar spine or the lower back. In this region, the nerves are a bit like branches of a tree. They travel down within the spine, and at each segment in the lumbar spine they pass out through small bony tunnels which the disc sits very close to. And if you have some situation which damages the disc, or in some occasionally a sudden prolapse, then that bulging can produce compression on the nerve and cause sciatic problems. Now, there are different types of disc bulges, from a simple strain of the outer portion of the disc, a region known as the annulus, and this can just simply bulge and strain, just like if you rolled on an ankle and produce a sprain of the ligaments in that situation. So that's a strain. It causes a little bit of swelling and some bulging, and it can put a bit of pressure on the nerve, but it's a much more stable type of situation. When people talk about a slipped disc, what they really mean is that the outer coverings of the disc, or the outer casing of the disc, the annulus, has become torn or disrupted, and the jelly-like substance known as the nucleus pulposus in the center of the disc has leaked through and has come out of the disc through the outer casing and is then pressing on the nerve, and that's a full-blown disc prolapse. But in reality there are lots of different stages of this kind of a condition, from annular bulging, which then settles down and heals quite well, to more frequent tearing of the annulus, which then causes sometimes a reduction in the height of the disc. So instead of having a nice springy shock absorber in between each vertebrae, the disc space becomes a bit more narrow and a bit more compressed, and that has two functions. One, it reduces the shock absorbency in the lower spine, so that can sometimes mean you're a bit more vulnerable to injury. But also, when the two vertebrae become closer together, it narrows the space for the nerve where the nerve travels out. So you don't necessarily have to have bulging of a disc. If the disc's height becomes a bit shrunken, then you naturally narrow the space for the nerve anyway. Now, oftentimes we get two things happening together. We get a compression or a narrowing of the disc base and a bulge occurring as well, and if that happens to occur in the area where the nerve is, then unfortunately you can get compression on the nerve. It's a common but incorrect belief that discs can be put back in. We often describe it as trying to put toothpaste back in the tube. What's really happening when disc pain resolves and sciatic pain resolves is that the swelling around the bulging disc reduces in size, and the swelling around the compressed nerve reduces in size, and those combination of things usually then allow more normal mechanics to occur to get the pressure off the nerve. It's really only in situations where there's a large proportion of material pushing and squashing the nerve, in which case the extra swelling is just a bit of extra swelling, but there's still a lot of structural compression on the nerve, and they're the patients who are in that 10% bracket who do require a surgical decompression. But the other 90% are generally managed with conservative treatment. Now, it's important to note that not all disc bulges are painful. We now know that if you scan 50% of the population over 40, they will show signs of some disc bulging which may not be symptomatic at all, and these are often changes that have just occurred slowly over time. Some would argue that they're just simply age-related changes rather than actually pathology or a dangerous situation. So we as clinicians, we always have to judge when we see an MRI scan which shows bulging, does it correlate with how patients are presenting with symptoms, because those two things are very, very closely related. In some situations you'll see people with poor scans that should function very well, and the reverse is also true, where you see people with modest signs on a scan but who are quite limited functionally. So you have to look at the whole thing as an integrated package. There can be lots of different reasons why the disc is under pressure. That can be people who have poor posture, who spend prolonged time in seated positions. Sitting puts a lot of static pressure on the disc. People who have poor muscle control, if the muscles don't function properly, it ends up putting more pressure on the joints and the disc and other materials, so they can gradually wear out over time. And poor muscle control means that there's more pressure goes onto those structures rather than being distributed through the muscles. Lack of flexibility, that's another common cause. So very often we find increased pressure on an area where the joints above or below aren't moving freely, because the result is that it ends up concentrating all of that pressure on that particular area. So when people present to us for treatment in clinic, we have to work out what are the dominant features here. Obviously we have to treat the symptoms, that's the first priority, but we also have to search deeper to find what the underlying cause is and develop treatment techniques and exercise programs that can try to prevent that. So that's a very quick summary of what goes on with disc related changes and sciatica. I hope you found that information helpful. If you did enjoy it, please give us a thumbs up. If you have any questions, feel free to enter them in the comments and we'll answer those in a future video. Please feel free to subscribe to our weekly videos where we give updates, tips and general health information. I'll see you again on another video.